Measurable residual disease, MRD, is currently adopted only in clinical trials in CLL, and the threshold is defined based on the flow cytometry assessment at 10 to the minus 4, meaning at the level of 1 CLL cells among 10,000 leukocytes. We are very interested in the development and the standardization of MRD assessment because now we have clinical data suggesting that we can tailor treatment duration based on the MRD response in order to achieve long-lasting disease control. So we want to use, hopefully soon in the clinical practice, this approach in order to intensify or shorten treatment, add further compounds, and improve the response while the patient is still receiving treatment. We are not there yet, but we have very encouraging data in this regard. So first step would be to standardize the test, and then once we are able to perform in a reliable way this assessment, we can also discuss how to implement it in clinical practice. Nowadays, clinical trials based on basically two different approaches. One is to intensify treatment if the patient remain MRD positive after a while. And the best example is the FLAIR study that was recently presented, where they prolong treatment duration for the amount of time needed to achieve undetectable MRD. So if the patient achieves undetectable MRD after 12 months, he continues treatment for a total of 24 months. If it takes longer, the treatment is continued accordingly. This is one approach, and I think it's very helpful in improving the depth of response. On the other side, we should acknowledge that there are patients carrying a highly responsive disease who would probably need shorter treatment duration. And we are currently running a clinical trial where we test MRD after few months of venetoclax-based combination and try to randomize patients to discontinue treatment earlier if they achieve undetectable MRD after only few months, or continue according to the label if they are still carrying detectable disease. So I would say that probably in the future both approaches will be relevant to investigate.